Good morning, chairpersons, and good morning, everyone. My name is Kanjira Kanpittaya. I am a senior intern student from Anesthesia University. It's our honor to present our research in RFC International today. Our research topic is safe injection by the intern student. The anxiety is an emotional that feels endangered, insecure, or in unpredictable situations that have effect on the psychology and mind. In the study of Achaya found that there are many factors that can cause anxiety in the entrance clinic, such as the surroundings environment, the entrance procedures, during sounds, local anesthesia injections, or white clothes or dentist. Furthermore, the procedures delivered by dental students may affect higher anxieties of the patient that according to the time and length of visit. In medical history, music therapy has used to treat many kinds of sickness as an alternative medicine with safe, low cost, and low side effects. From former studies, the tempo and the volume of song used for the therapeutic purpose should be around 60 to 80 beats per minute and 60 to 90 decibels to prevent any possible harm to hearing organs. So we decide our particular clinical question. Can music therapy reduce anxiety in the cognitive injection procedures given by the intern student? Objectives: to reduce anxiety of the patient during the cognitive injections by the intern student, included comparing pre-operative and post-operative and anxieties and vital signs. Hypothesis. No hypothesis is music therapy should not different in the cause anxiety for local anesthesia injection. An alternative hypothesis is music therapy show different in and dental anxiety. I cannot. Okay, the inclusion criteria are male or female patients older than 18 years old. Patients in criteria are ASS1 and ASS2. Patients with no history of allergy to local anesthesia used in this study. Patients who are not under antipsychotic drugs. Patients who can understand and communicate in Thai language. Patients with history of one tooth extracted. Exclusion criteria: patients who cannot tolerate dental extractions under local anesthesia. Patients who are under medications with interactions with methylation. Patients who are unable to hearing impairment and patients who with no anxieties. To use in the study, we use digital blood pressure monitors, anxiety score questionnaires, pain score questionnaires, satisfaction score questionnaires, earbud, and smartphone. Data collections. The data collections we use are demographic data. Anxiety scores, vital sign rate is blood pressure and heart rate, pain and satisfaction score. Procedures and methods. Firstly, we screen and exclude the patients according to the criteria mentioned above. Then an explanation was given by the patients to choose a song and fill out the MDAS questionnaires. After finishing, the patient was accosted to the operating room and the first vital sign was taken. Afterward, the chosen song was played via an earphone with the volume no more than 60 to 90 decibels under the researcher's care. For the control group, we used the earplug instead. Next, the operations performed the injection. And then we set the patient in resting position and the second vital sign was taken. Lastly, pain and satisfaction score questionnaire was given to be filled and the operation continued as scheduled. The data analysis used in the study were Kolmogorov, Monov, and Swallowick tests for testing the normalities. Independent tests we used to compare the mean between two unrelated groups with normal distribution. If not, we use the man-Whitney test instead. And we use the pair t-test to compare the mean with pairs group with normal distributions. If not, we use the Wilcoxon filing test instead. Result? The demographic data show a total of 60 participants composed of male and female divided into music group and non-music group. And the age varied from 19 to 71 with the mean of 35 years old. The education staff shows 66.6% were bachelor's degree, 33.3% were high school and elementary, and 1.6% master's degree, and the other 5%. Element staff show most participants with history of one-time and two-time tooth extraction. And scientific stats show 56.6% of the patients are low anxiety levels and 3.3% extremely high. For preoperative and postoperative vital sign comparisons show no significant difference between music and non-music group, except the heart rate or non-music group. Preoperative and postoperative and anxiety score comparisons show that there was significant difference between preoperative anxiety and postoperative anxiety in music group, while there was no difference very far in non-music group. Into the upper tooth and lower tooth shows that there was significant difference of anxiety in music group of both upper tooth and lower tooth when compared between preoperative anxiety and postoperative anxiety. However, there was no difference found in both non-music groups. Discussion and conclusion. So, the anxiety decreased gradually after preoperative to postoperative procedure in music group. Music therapy can reduce mental anxieties of the patients dealing oconidicid injections by dental students. And the use of music therapy is a simple, safe, inexpensive, and non-pharmacological intervention. Thank you for your kind attention. Thank you so much.
Thank you. And so briefly, your research showed that music could help reduce anxiety, right? So is there any question from the floor, from the audience?
Yes.
Please.
Can I speak now? Yeah. How do you select the type of music? That I think, yes, in your study, I'm not sure that the types of music will play roles.
We choose the song that have the famous or the kind of music, like a pop or rock or like a Thai school or many kinds.
No.
But the patients have choose only one song.
Yes, but it seems to me that if you have the music like very fast rhythm, it will make the most anxiety. I'm right.
Yes, but we control that the music not have the rhythm that's no more than 60 to 80 beats per minute. That like the same of the heart rate.
All right. How about the classical music? Does it work well?
That is okay. But it depends on the patient that what their favorite song.
Okay.
Is there any question? So please, Dr. Vacharapon. Presenter 3 ค่ะ
Please, Shalapon, okay.
Please.
Please, Ajahn Shalapon.
How you know any music fit with the patient, because some patient don't like that music. I go to dentist. I don't like any music because I need to hear the dentist talk about my diseases.
That is the limitations of our research, but we have to control as much as we can.
Okay.
But maybe we shoot them in the control.
Yeah. Ajahn Sutima, please.
Can this apply to the children, this method?
I think it can, but because it's already just in the dental clinic that we can use it, maybe in the future.
And your method seem to be very interesting for the adult patient. So you will use this method in the routine. Go to the operation.
Yes, we can use that, but maybe we don't have to use an earphone. That just in the open the clinic, can use that.
Is there any question from the floor?
Yes.
Yeah. Yes.
The music is instrumental or vocal?
Or now he use the vocal music, but we have and that's like a classic too.
So it depends on patient's favor.
Yes.
So does your include like a nature sound such as a bird singing or water streaming, something like that also?
No, we didn't use that song.
Because I heard that sometimes when people cannot go to sleep, they will listen to their nature voice to calm there. So I think it might help patient when they come to do the dental treatment. Yeah. I think it would be interesting.
So, and thank you, Kanjira, for the interesting topic. So let's move to the next